I understand and consent that the following information will be gathered and utilized for educational purposes by Indiana Wesleyan students. I allow this information gathering and physical assessment to be videotaped and posted on YouTube for access by faculty at Indiana Wesleyan University. The video will be deleted by the student as soon as it's been reviewed and graded. I further acknowledge that this is for educational purposes only and information is not meant to be diagnostic. Therefore, Indiana Wesleyan University, the faculty, and the staff, as well as the student, are not considered liable.
Hi, Sarah.
Hi.
I'm Rachel. I'm going to be your nurse. I'm going to do your full head-to-toe assessment. If at all you feel uncomfortable, just let me know. I'm just going to start. I'll be touching throughout your body, just feeling for any abnormal stuff. But if you have any questions, just let me know through it.
Okay.
All right. So right now I'm just inspecting the skin. And your skin color is consistent. There's no lesions, there's no masses. Her hair looks smooth, it's not brittle, it's not greasy or oily. Her scalp is soft, it's round. Again, no masses or lesions. Any pain when I touch that?
No.
Okay. So then I'm just going to feel for her temporal artery. Any tenderness?
No.
It's elastic without tenderness. Her face is round. So then I'm just going to assess her temporal mandibular joint. So I'm just going to touch that and have you open your mouth. Any pain?
No.
And I didn't feel any movement with that. That's good. So I'm just going to test her cranial nerve have her smile, frown, lift up her eyebrows, blow out your cheeks, and then tightly close your eyes. Awesome. So then I'm just going to check your sensation, and then I'm going to have you close your eyes and then tell me where I'm touching.
Okay. Forehead, right cheek, left cheek, chin.
Okay, good. And then I'm also going to I'm looking at her ears, her auricles. They look symmetric bilaterally. No abnormal colors. It's consistent with the rest of her face. There's no lesions or swelling. No discharge from her ears. I'm just going to test your, do what's called a whisper test. So what I'm going to have you do is cover your left ear and rub it. And then I'm just going to say a two-syllable word, and I just want you to recall it.
Popcorn.
Okay, so I'm going to do the same thing to the other side. And have you recall it.
Popcorn.
Okay. All right. So with that, I'm just going to rub your nose. I'm going to palpate your nose and feel if any lesions or tenderness. No. And if there was, then I would go on to assessing the maxillary sinuses with a pen light, but she doesn't have any abnormalities. So what I'm going to do is just test each nerve in your nostrils. So I'm going to have you sniff in. So proper inflation with the nose. Now I'm just going to go on to assess your your pupil response. Sorry. They're round, brisk, and reactive, about 3 millimeters, I would say. One more time. Okay, I'm going to have you focus on that picture out there. And the light is reflecting on both of her corneas symmetrically. Okay. And then I'm going to have you as well focus on that picture right there, and then I'm just going to test for the fixation. Okay. Both of her eyes are fixated on there properly. And I'm just going to look at them inside your mouth and have you say ah. The uvula does go upright. Her gums are moist. Her teeth are perfect. There's no lesions or discolorations in her gums. Her tongue is smooth. And the upper palate is smooth as well. There's no bleeding, there's no swelling, there's no whiteness. I'm going to test your tongue string, so I'm going to have you push against me. Good job. Okay, good. So now I'm going to move down to your neck. So what I'm going to do is inspect the neck for any lesions, masses, or swelling, and then test your range of motion. I'm going to have you look up to the sky, put your chin down to your chest, and then go try to touch your ears to each side. Very well. All right. So then I'm inspecting, no masses or lesions. Her trachea is midline. I'm going to feel for her lymph nodes. Still no masses and lesions. Any tenderness with that?
No.
Okay. So then I'm going to, what I'm going to do is feel for your carotid arteries on each side, palpating one at a time. And they're strong. I'm going to listen to them. I'm not hearing any swishing, which is good. Okay, so I'm going to just test your strength of your head. So I'm just going to have you push against my hand. Don't let me fight back. There you go. Do the same thing this one. Don't let me fight back. Okay. So then now I am going to have you distinguish. I'm going to put an object in your hand. There's two different objects. There is a key and there's a cap. So I'm going to have you close your eyes. I'm going to place one in your hand and you tell me what that is.
Key.
Okay.
Cap.
Okay.
Key.
Okay.
Cap.
Okay. She was able to distinguish the two objects in both hands. So now I'm just going to take a look at your upper extremities. I'm just going to note the color, the temperature, if she has any swelling, any abnormalities. There's no swelling. The skin is still consistent with the rest of her body. I'm going to test her capillary refill. Comes back in less than 3 seconds. Now I'm going to palpate the brachial artery. And it's strong and present bilaterally. The radial. Strong. And the ulnar strong as well. So now I'm just going to test your muscles and test your musculoskeletal. So I'm just going to have you put your arms out. I'm going to have you flip your hands back and forth, bend your arms, put them above your head, touch your head, pat, 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 and then act like you're arrested, good deal, and then put them back down. So then I'm going to have you resist me for your muscles. Don't let me squeeze in. Good, good, good. Same thing with this one. Don't let me squeeze in. Very good. All right, so with that, I'm going to assess her shoulders for any tenderness, her scapula for any tenderness or abnormalities. No tenderness, no pain. All right, I'm going to have you stroke your head, stroke your shoulders. Very good. All right. So now I'm going to go into her posterior and her lateral chest. I'm inspecting for barrel chest. I don't see any. I'm just looking at her breathing. She's not using any accessory muscles. She's breathing fine. Doesn't appear shortness of breath. Her anterior posterior diameter is less than her transverse. So now I'm just going to come to the back and assess the back as well. So right now I'm just feeling for any crepitus, so I'm just going to palpate her back. And I'm not hearing any crackles. I'm going to evaluate her chest expansion by having her take a deep breath as I, hold on one second, have her take a deep breath when I assess the T9 and T10, so I'm going to have you breathe in. My thumbs were able to expand between 5 and 10 centimeters. I'm going to go ahead and percuss, checking for any resonance, dullness. So resonance is normal. And then I am now going to listen to her lungs, starting at the upper back and working down through the 9. I'm just hearing clear lung sounds, no adventitious sounds. Her respirations still are unlabored and even. Her posture is erect. It's very erect. Okay, so I'm just going to come to the front and do the same thing. Sorry. Okay. So I'm just going to feel the same way I did on the back for any tenderness. Any tenderness?
No.
Still breathing shallow but even and unlabored. So then I'm going to percuss. And her sternum is midline. So I pinched it just for the skin trigger, which is elastic and it returns back very quickly. I'm going to listen to her lung sounds, checking for any adventitious sounds. Take some slow deep breaths. There you go. Okay. So the next thing I'm going to have you do is lay flat. I'm going to put a pillow behind your head because I'm going to lift your head up, assess a little bit more. Just lift up your back. There you go. Assess for her jugular vein distension, which at 30 to 45 degrees, and it's normal not to see it. Okay. So then I'm going to go down and listen to her heart sounds. I'm going to assess at her apex of the heart, noting her rate and her rhythm. I hear a lub dub. And assessing her lung sounds or her heart rate for about 15 seconds. And her heart rate being about 68. She still continues to not use any accessory muscles. Okay. And then now I'm going to remove this and I'm going to move down to her abdomen. I'm just going to lift up your shirt. So I'm still noting the consistency of her color, which is throughout her whole body. Any masses, lesions, swellings. She is a thin lady, so I do see the aortic pulsating. The aortic artery pulsating, or abdominal aortic pulsating. Her belly button is midline. It's inverted. Okay. I'm just going to listen to them before I palpate it and percuss. I'm listening to her bowel sounds. They should be active. So her bowel sounds are present. Alright, so now I'm just going to palpate. Do you have any tenderness?
No.
Still feeling no masses or lesions. I'm palpating for the liver. So I'm moving my hands, my finger underneath her rib cage. I'm not feeling the liver, which is not abnormal. Okay, I'm doing a deeper one. No facial grimaces. She's still not complaining of any pain. So I'm just going to percuss. It was dull over the liver. And a little dull over the spleen, which is normal. Okay, so I'm going to have you sit up for me. All right, and I'm going to assess her legs. Just noting the skin color, the skin temperature. It's the same on each leg and it's consistent throughout her body. There's no swelling. I'm palpating her pedal pulses, which are present. Assessing her capillary refill for circulation, which come back to less than 3 seconds. Okay. Her skin is warm. Okay. So then now I'm going to assess her musculoskeletal system and her spinal curvature. So I'm just going to have you stand up, and then I'll have you face that way, sorry. So I'm just going to have you bend over, touch your toes, and I'm noting that her spine is in line. There is no curvature. There is no abnormalities. All right, so I'm just going to have you walk. I'm going to have you stand back up and walk to the chair and back, and then walk back to me. Okay. Her gait is normal, it's steady. There's no deviation. So I'm just going to have you stand straight and then have you lift up balance on one foot. Okay. Then lose your balance and do the other foot. Okay. So now I'm going to have you put your arms out, close your eyes, and touch your nose with one hand, and then with the other one. Okay, very nice. And then put your arms down. And then just looking at her hips and seeing if they're symmetric, which they are. I'm going to have you look towards camera. Okay. And then just have you close your eyes and check her balance. Okay. And then I'm going to have you hop on one leg. Okay. And then hop on another leg. All right. All right. And of course, I'll have you sit down. With restricted instruments and stuff, a full assessment would not be completed, but for a basic assessment in the home, my name is Rachel Chrisman, and this completes my head-to-toe assessment.